Press record. Good afternoon, everyone. Welcome to the weekly webinar. Happy April, happy spring. Glad to have you here today. Remind everyone of our housekeeping notes. Please make sure you're muted, and you can use the chat feature as you have questions or comments during our time together. We are recording, so this presentation will be available later on our YouTube channel and in the My Alliance newsletter to watch again or to share with someone you think might find it helpful. If you need closed captioning, there's a CC button at the bottom of your screen that you can use if you want that. Other than that, those are all of the housekeeping announcements. And so I'm happy to welcome back, of course, to the weekly webinar, Dr. Jaime Perales Puchalt, who is going to talk about the CuidaTEXT program. I'm not going to say much about CuidaTEXT because that's what we're here for. But briefly, it is a study that's evaluating text messaging to support and educate caregivers. And Dr. Perales will tell us more about that in just a few moments. He is an assistant professor at the CuidaTEXT and has a background in psychology and public health, and is from España, Spain, and speaks, I believe, all of the languages of Spain, plus English, plus Alzheimer's disease. So we have a real expert in our midst, and Dr. Perales has a focus on disparities in dementia in Latino communities, which the CuidaTEXT study is focusing on. And he studied lots about dementia and mild cognitive impairment among different racial minorities. And he's also, I will say, our ringleader for the outreach, recruitment, and engagement for at the KU-ADRC. And we are very happy to have him on the webinar today. And we've got a couple other folks from the CuidaTEXT team online. So Dr. Perales, I will turn it over to you. Thank you for being with us.
Thank you, Kelly G. I'm going to go ahead and share my screen, and we'll be able to talk to introduce the team members that could attend today. So some of them are right now seeing participants, but some others have been able to make it. So we'll have them introduce themselves later on. Thank you for the introduction. First, I don't speak all the languages in Spain, unfortunately. I would like to. I speak two. There's at least two more official ones. There's Castilian Spanish. That's the one that when you hear Spanish, that's the one that's called actually Castilian. In Spain, we call it Castilian. And then Catalan Valencian, which is what I speak as well. And then there's Basque. That's very different to any other European language. And then Galician, that's basically like Portuguese. So that's a little bit of unrelated, but it's fun. I like people to know, those. The more we know, the better, always. So thank you for having me, and I'm gonna talk about this program, CuidaTEXT. That's the first ever text message program to deliver education and support related for dementia caregivers, especially among Latinos, but honestly among any population. So that's the main innovation of this particular program. And this, I work at the KU-ADRC, like Kelly G said, and also we have this amazing partnership with the Juntos Center for Advancing Latino Health, and together that's what Juntos actually means. We're Juntos for Brain Health. That's what our partnership is called. I'm going to go to the next slide. Let's start with a little bit of background. Dementia has a devastating impact on family caregivers. We tend to think of the person with dementia and mortality, disability, etc. But actually, family members can also have a really hard time. So physically, psychologically, and financially. When we talk about physical, compared to non-caregivers or care partners, caregivers have more stress hormones, especially a hormone called cortisol, related to chronic stress specifically, that can impact a lot of health outcomes, physical and mental. And then also lower antibody responses, so more infections potentially, and more physical symptoms such as pain. And just imagine if you have a loved one who is no longer to physically do certain things, you might have to carry them or help them get up from the bed, etc., etc. That can cause a lot of pain if you do it every day. And then more medication use, and there's a problem called polypharmacy, there could be interactions with some medicines with other medicines, some medicines with specific foods, etc. So the more medication, technically, the more risk you are of that. Psychologically, which is what I study more, family caregivers have more depression and anxiety disorders compared to non-caregivers of the same age, compared to people who care for loved ones with stroke. And I didn't include it here, but also compared to caregivers who care for loved ones with schizophrenia. And then financially, family caregivers of people with dementia also have more financial difficulties compared to those with no dementia. Why should we focus on the Latino community specifically? Well, when I'm showing here, Latinos are in orange, non-Latino white individuals are in blue. I'm saying non-Latino white because there's white Latinos and there's black Latinos and there's Latinos of any racial background. Latino is an ethnic or cultural group. It's not a racial group. And so Latino men and Latino women in the United States have a higher risk of dementia. And we can talk about reasons later if you have the questions, but the main thing is we don't know a lot about it and we need to know more. That's my main response for that. Latino family caregivers also have a higher rate of depression compared to non-Latino white caregivers of people with dementia, but a lower access to dementia caregiver support. So more depression, but lower access to help. And there are more than 200 programs out there to help family caregivers. A lot of them that have tested to be efficacious. The problem is these have not been tested usually with the Latino community. It usually includes a majority non-Latino white, and even fewer of these programs have been tested having the Latino community in mind and their barriers and their facilitators, their cultures, their preferences, their context, etc. And so if that has happened, what that probably means is that the ones that exist, many of them might not work well for the Latino community, right? In fact, there was a recent review of the literature that showed that a large percentage of these of the programs that exist for caregiver support vary, like the outcomes, so how well they work, varies likely. Varies a lot by race and ethnicity. So what we're creating right now might not be generalizable to basically to the Latino community. And there are many barriers that conspire against access to dementia care among Latinos. One of them is time constraints. Latinos are more likely to have multiple jobs, and so their time might be more limited. They're also more likely than non-Latino white folks to be in sandwich generation. So I'm not just caring for my loved one with dementia, I'm also caring for my children, grandchildren, and et cetera, because there's a lot of multi-generational homes and very close-knit families. And then they're also less likely to pay for someone who could respite care, basically someone who could care for your loved one while you go to the support group or while you go to the psychotherapist, et cetera. There's also in the Latino community more unreliable transportation. The Latinos rely more on public transportation, which is, the system. We have a system, but it's not great, right? There's obviously if you have your own car, you're going to be able to get faster to different places, and you're going to be able to get there more reliably. There's also a higher perception of higher cost, right? Because the income in the Latino community is the median income of their Latino household is lower than other groups. And then there's also cultural barriers. There's stigma toward dementia, and many of these things happen in all groups, but it's particularly important in the Latino community. There's a stigma towards dementia that prevents people from looking for help, right? Seeking help or acknowledging that they have a problem or that their loved one has a problem, right? And that's a big barrier to looking for help, etc. There's also obviously the language, right? There's a large percentage of Latino community that prefer to communicate in Spanish, and some that are just not proficient in English, right? So that's going to make it very hard for these people to participate in caregiver support. Kelly, I don't know if we should address, I don't know, I haven't seen the questions or comments on the chat, but I don't know if we should address them now. Does that matter, or at the end?
Up to you, up to the audience. I think if you're open for questions anytime, bring them on.
Oh, okay. Oh, I saw that there were your comments. Okay, there were your links for the
Yes,
website to CuidaTEXT. Perfect. Thank you.
yes,
Yeah, and if anyone has comments, I'll leave this chat open and I'll be reading them, and I can, I'm happy to address them as they come.
yes.
Thank you. So after seeing studying all these barriers, these needs, etc., we're like, well, here's a solution. Text messaging. It's not as novel and some people call it sexy as apps or more modern things, right? It's true. I mean, texting has been going on for I think 30 years now. Recently turned 30 years old. The whole short message system texting, the typical texting that we all have on our phones. The reality is, who doesn't have a cell phone and who doesn't use it for texting? Who's not able to text? Almost everyone can text and almost everyone has a cell phone. Whereas apps, not everyone can use apps that easily. Not everyone can use video calls that easily, etc. So that's the main reason. It's something that almost everybody has, almost irrespective of their age, their social status, language, etc., etc. So it's a way that we can communicate and deliver a caregiver support program through it. You're seeing it here, and these are all very old numbers that one day I will update, but because they're for 313, 20, so that's 10 or 12 years. But it was you could already see that almost 100% of people, irrespective of racial group they identify with, have a cell phone. Whereas computer ownership is not there. It's just simply not there. It's like 63% of Latinos versus 96 of cell phone ownership. And then for texting, in fact, Latinos are the highest users of text messaging from out of all the other groups. Whereas, cell phone internet use was not as high. I'm sure it's higher now, but it's still not as high. And cell phone video chatting, same thing. I'm sure it's gone up, but it's still not reaching almost 100% like text messaging and cell phone ownership. So that's why we decided to use something that's not as sexy and modern, but it's something that is accessible. That's the key thing. It's accessible. And there's many other things that are important. There's many here that you can see on the right, but the one I like is you can access your education and your support wherever you are, so anywhere and at any time. Whether you're in Kansas City, you're in Garden City, whether you're at home, at work, in bed, you can access it through a text message, and you can interact with it as well. So that led us to work on develop the first to apply for the first grant from the NIH. That was to develop and test how feasible, so how well it works and how much people like this product, right? So what we did was, I have here a library and then a lot of people, so that's just a pictorially summarize what we did. We looked at the literature, what works, what doesn't, what works especially for the Latino community, but also in general. And we turned those into text messages. And then we had a group of Latino family caregivers giving us feedback on what they like, what they don't, what they would add, how often we should be texting them, etc. It's how long should the program be, and just giving us a lot of feedback so that we can develop together with them a program that will ultimately help them and people in that community, right? That's called user-centered design. And that was the first year of the grant. The second year, we tested the program that we developed among 24 Latino family caregivers, approximately half of them English speakers, approximately the other half Spanish speakers. And we tested it during 6 months, and we gave them a survey at the beginning, what's called a baseline survey, and after 6 months. So this is called a clinical trial, a pilot clinical trial. But instead of giving medication, the intervention is a text message program to support and educate. To talk a little about the program, it's called CuidaTEXT because it means it's a play on words on cuídate is to take care of yourself. Cuida is to take care. And text is from texting. So take care of yourself, take care of your loved one, and text through texting, right? It's a play on words for that. And so it's got 3 types of messages. We send approximately 1 message per day that's automatic about different topics that I'll go over now. But they're as short as this one here. What 3 things are you grateful for? Better small than big things. Example, feeling the breeze, eating a food you like, or being with your loved one. That's just 1 message. So you will get 1 per day approximately for that. Then we also, but because some people want it more, we allow other 2 types of interaction with the program. One that's called keyword driven, and that means that every time you send us a specific word that we'll be talking to you about, you will receive a message on that topic. For example, if you every time you send the word stress, we will send you a text message to learn how to fight stress, how to cope with stress. In this case, it will be a link to a video on how to do mindfulness meditation. And then there's, besides these keywords, you can text anything you want, like you would text a friend or a family member, and we will one of our coaches, and we have at least 1 here with us today, maybe 2. They will get an email, a notification, and they will reply to you very soon. And then we also give people at the beginning a booklet just about how the program works. Basically, it's not necessarily an instructions book. It's more like I want to learn more, because you don't need instructions. It's actually quite easy to understand how it works. These are all the keywords that people can use, and we remind them of that almost every day, of the different keywords that they can use. And we give them examples as well, so they can decide which one they want to use if they want to learn more besides the automatic messages that we're sending. So some of them are focused on the family or friend caregiver. So like I mentioned, to reduce stress, to get more information about Alzheimer's, to learn about how to lead a healthy lifestyle. Then others are focused on themselves and helping others. So the one on support is how to support and be supported from your family, how to communicate with the doctor, how to communicate with the person with dementia, with children, resources in the community. There's one on grief, because of, unfortunately, that will be the end of the person with dementia. They all, like, we all end up dying. So it's a process, and it's important to learn about that process. Problem solving strategies for complicated behaviors that the loved one with dementia might have, as well as care options. So learning what is important, when the person should stop driving and how to do it, how to keep their home safe, and then addressing complicated behaviors if the person is anxious or has depression, wanders and gets lost, and to reduce the risk of that happening, or just simply to address it better. We tested among 24 Latinos, like I mentioned, Latino family caregivers, and basically here what we're showing is that the levels of satisfaction were very high. Extremely is in yellow, and very is in gray. So you can see that almost everyone said either very or extremely, to feeling like the program helped. They were satisfied. It helps them as a caregiver. It helped their loved one as the person with dementia, and it helped them learn about dementia itself. Other things that help with, the program helped with was reduce depressed mood in the caregiver, reduce their caregiver's strain, reduce the caregiver burden, increase their dementia knowledge, increase their sense of competency, like how much they think they can care for themselves and their loved ones, and it reduced or improved the care recipients or the person with dementia's mental health. So that was the pilot, which is the one here on the very left. And after that, we've had 3 other studies or programs. One of them was Alanza Latina, which we concluded very recently, and where we enrolled 100 Latinos with family members with dementia, of people with dementia around the country as well. Then we had CuidaTEXT. Unfortunately, it ended last year. And here we were serving people with the same, we call it CuidaTEXT, it's the English version, but we had it in English and Spanish for people of any background in basically Kansas City, Missouri, and surrounding counties. And that one, all of them are funded through the NIH, except for this one that was funded through the Mid-America Regional Council. And then now we have the CuidaTEXT efficacy study. So in the previous ones, and the top ones, we wanted to test how feasible, how much people like it, especially, and if it's feasible to conduct. But in this one here, we want to test if it actually reduces depression, distress, etc., etc. So now we are comparing it with a control group, like clinical trials have to do to assess if something really works, right? And for that, what we do is we identify people who are interested through very different modalities. This could be one modality, in fact. We screen them and see if they're eligible. If they're not eligible, we refer them to resources, free resources. If they are eligible, we will do an informed consent. So we will tell them more about this study, and only if they consent to do so, we will randomize them to one of 2 groups. The one group will be receiving CuidaTEXT automatically, so straight away for 6 months, and we will do assessments at baseline 3, 6, and 7 months. And then the other group is a 7-month wait list. So basically we will not give them any service. They could find their own service if they wanted to, but on their own, but we won't give them any service until after 7 months. And after 7 months, they will be given the option to join the program, the text message program as well. So everyone has access to the text message program. It's just that one group gets it straight away, the other one after 7 months. And like I mentioned, we do surveys at baseline 3, 6, and 7 months for all of them. Eligibility criteria, they have to be either English or Spanish speaking, be 18 or older, identify as Hispanic, Latino. Some people some people will say Mexican American or this or that. There's different terms, whatever, as long as it falls within that idea. Have a cell phone with a flat fee and text at least once a week or more. Being a hands-on, providing hands-on care for of community living, basically of a loved one or a friend with dementia. And that means if you're a family member and provide emotional support, like for example, for my grandmother, if I go there and visit her every now and then, we would consider that a caregiver already. Okay, sometimes there's a little bit of it's a little hard to understand what it is, so just to clarify. And dementia could be diagnosed through a clinic, but we could, it could be through research as well. So if you don't have if you know someone but they don't have a clinical diagnosis, it's okay. Just still put them in touch with us. Not living with another CuidaTEXT participant, not being in another well-being trial, and not have and they would need to have some depressive mood. They don't need it's not necessarily a diagnosis of depression, and that's something that we will measure with some questions. So don't worry too much about that one. Let's skip this. We're gonna skip this. We have 4 sites. We have 1 at the KU-ADRC, 1 in Puerto Rico, and 2 in Miami. And we're enrolling 288 Latino family caregivers within 4 years. They can speak English or Spanish, like I mentioned. And now I'm gonna go. These are the team. This is the team and the roles. We have several people. Obviously, not everyone has come here, but I wanted them to talk to you and to introduce themselves. I'm personally basically the director, or what's called the principal investigator of this study. I can see here, who have we got here? Christina. I don't know if we got more of us here, but Mariana as well. Would you like to come up to the stage digitally and say hi and what you do?
Go, Christina.
Hi, all. My name is Christina, and I work with Juntos. So, Mariana and I work with Jaime under Juntos for Brain Health. I worked with Jaime on the two previous projects, Alianza Latina and CuidaTEXT, and I will be working as a coach on this current study. So, if anybody texts in, has any questions, needs any resources, that's what I'm here for, to respond to those, or just need any emotional support. That is kind of what I will be doing throughout the project.
Thank you, Christina.
And I'm Mariana Ramirez. I am the director of the Juntos Center for Advancing Latino Health. And I co-lead with Jaime our Juntos for Brain Health initiative. We've been working together since the development of the library. So excited to now be part of this larger effort that has a national reach. I support the team in multiple ways to make sure that everything is running. So I'm more of a like a backstage person. My role is as a co-investigator for the study.
Thank you so much, Mariana. And Mariana and I have been working together since 2015 in different projects, and actually several on text messaging for not just for dementia, but for helping people quit smoking and reduce diabetes risk, et cetera, et cetera. So we've been doing some research together for a long time. Thank you. I'm going to share this screen before I end the presentation, and I know that we're pretty close. Let's see if it works. All right, so if you're interested, participate in this study, and here you have a, whatever these are called, I don't know what they're called, a code,
QR
something.
code.
You
A
are.
QR code. I'm really bad at this. So a QR code, you have a phone number here, which is the number of the ADRC, option 1, and visit you could visit also kuadrc.org/CuidaText-en for English. There's one in Spanish as well. So if you know someone that could be interested, please spread the word. Unfortunately, as also the director of the Outreach Recruitment and Engagement Corps, I know how hard it is to recruit as well. And part of why many studies fail is because we don't get enough people. So the more you can all collaborate with us in identifying potential people who could be part of the study, volunteers, we would really welcome that. And we also have a Facebook pages. If you're here, you probably follow us on My Alliance and our Facebook page. We have those in English and in Spanish as well. So feel free to spread the word, support our research, as well as I'm sure many of you are already doing it. So I really want to take this time to appreciate your help. Thank you.
Thank you so much to Dr. Perales and the CuidaText team. Every time I get reminded that Cuidate and text are like a pun, I'm so happy. I love that. I love that play on words. That's such a nice thing to point out. And one of my other favorite things about the CuidaText study is it's such a good example of how a non-medical intervention can be helpful. People hear about research, of course, and I think they think we're all in a lab with a test tube, or we're poking people or doing strange things. And it's so nice to know that something like a simple text message, which, as we heard, everybody texts, everybody can do it. We all communicate that way. Some of us prefer it to the telephone even. It's such a nice way to advance what we're doing in terms of brain health and caregiver support. So I'm really excited about this study. And Dr. Perales, I don't know if you and I have talked about recruitment in Puerto Rico specifically. That is not a place I have been yet. So you can tell us.
That's
Okay.
a good one. We'll send you to Puerto Rico.
Just so you know. Okay, good. See, I got that on the recording. So All right, everyone. Thank you so much for being here. Please reach out to the CuidaTEXT team if you have questions. Check out the links that we put in the chat. We also have the link, I believe, to CuidaTEXT in the My Alliance newsletter, or we will going forward, so you can get back to us.
We have,
Next.
Kelly,
go ahead.
one more thing. I think,
Yes.
yeah, Mariana shared the flyer. If anyone wants to download it, it's on the chat as well.
Okay. So
Thank you.
take advantage of those resources. Let us know if you're interested, and we help us reach out to folks that might be able to participate in the program. And we know that when we help as many people as we can, everyone benefits. So what we learn from CuidaTEXT, even though it is for Latino people, we will learn things from this study that can be applicable to all kinds of caregivers. All right. So as we finish up today, I'm super excited. I just got confirmation about next week's or I already spoiled it. Next week's webinar. I will be your host and musical guest again next week, except not the musical part. But I was just watching Saturday Night Live before this. So I will be the host and the guest of the webinar next week. But I just got confirmation from a longtime supporter of our webinar, Dr. David Byer, who is a physicist and a real brain health expert. He and I are going to do some live brain boosters next Thursday with you on the webinar. We'll see how that goes, but we'll talk about whether brain boosters are effective. We think they probably are in some way, and what that might look like. We may do a couple of live ones, no wrong answers. And we'll talk about why brain boosters might be good for you. So if that is something that appeals to you, and I hope it is, please join us next Thursday at 2:00. And we'll have more information about that in the newsletter that comes out on Monday. CuidaTEXT team, muchísimas gracias for being with us today and for leading such an important study. Thanks to all of you for being with us today, and stay tuned for the next issue of the My Alliance newsletter. Have a great week. Bye-bye.